Welcome to Oster Oncology. I am Dr. David Oster. It is October and it is Breast Cancer Awareness Month. I will be making a bunch of videos throughout this month, educational pieces focused specifically on breast cancer. So we will be talking about treatments related to breast cancer and the therapies. For instance, the aromatase inhibitors and tamoxifen, we'll be discussing those and how to tolerate those better. We'll be getting into some of the pathology, how to understand some of your surgical reports and some of the details of those. And then I'll be putting together a video also on just the basic biology of receptor status. So understanding your estrogen receptors and progesterone and HER2 new receptors as well. So look for those. I'll be getting those out throughout this month. Again, just to really focus on breast cancer. This video, however, I really wanted to just make it in honor of the ladies that are walking through a diagnosis and treatment and have perhaps moved past that as well, and they're into their survivorship, cancer-free time as well. Applauding to all of the ladies that have walked through that type of treatment. Breast cancer has a special place in my heart. For most of my 5 years at a hospital, I was on the vast majority of my time, I was on a breast cancer center of excellence team. So I worked right alongside the medical oncologists and the surgical teams as well. And the number of patients that you spend time with, all of these ladies moving through breast cancer treatment and diagnosis, you start to realize, especially when you start to treat other types of cancers as well. So I was also overseeing other departments as well, and every other type of cancer you can think of. What's unique, what you start to understand is what's unique about breast cancer and the treatments is that it has so many phases to it. So all of you ladies that are walking through treatment, you've got my heart and my respect, because the types of phases of treatment, the multiple phases of treatment, you don't always see in all other types of cancer. And so definitely when if you're dealing with an early stage, locally advanced, obviously surgery is really central to what has to happen. You need your surgery, and that's clear. But also what a lot of the ladies are facing when they first are diagnosed and the treatment plan is laid out before them. Again, there's so many phases to treatment. So you can have surgery, but then there's often chemotherapy, neoadjuvant, pre-surgical chemotherapy leading into surgery. And then of course you can actually have chemotherapy again afterwards, adjuvant chemotherapy. And then radiation is always a piece, often when we're looking at locally advanced diagnosis and cases. And then of course after that, then we have to enter into this, especially if we are hormone positive, estrogen receptor positive, we walk into this phase of 5 years, maybe sometimes 10, of this anti-hormonal therapy, either with the aromatase inhibitors or tamoxifen. And so what is unique, and which is also taxing on your time, on your energy, on your perseverance, on your hope sometimes, on your faculties of just staying up and strong, is these different finish lines that you've got to walk towards. So again, finish line 1 of chemotherapy, and then the surgery recovery, and so on and so forth. So there's multiple finishing lines that you ladies have to focus on and just do your best to get to, and you do get to them. You obviously do, and the treatments, these multimodal treatments, these many phases of treatment, are very essential to you. So if you are in an early diagnosis, if you're in that place, then please know everything that you are pushing through is so important. All of them have been shown to really help long-term, 5-year, and there's some studies now that have just come out, 9 and 10-year survival rates as well, and long-term anti-recurrence, dropping the risk of recurrence long-term. And so the chemotherapies around surgery, of course the surgery itself, definitely the radiation. Radiation has been shown in most cases to drop risk of recurrence down by at least a half and even 2/3. And so when we are left with a 20 to 30% risk of recurrence with surgery alone, these other treatments that come alongside either before or after surgery, they really play a major role in your long-term benefit. And so they are essential. So if you're going through them, please know that they are definitely worth your time and your energy and your efforts to get through. With all of these phases of treatment, integrative oncology, Oster Oncology, this is what we provide for our patients. Integrative oncology plays such a big role for our breast cancer patients. So there are so many things that you can do naturally to protect certain tissues and organs that are vulnerable during chemotherapy, certainly to protect you during radiation, recovery after surgery. There's some things as well. And a big portion of my energies and efforts with the breast cancer patients at the hospital and now in my private practice are to mitigate and really take away the common side effects that we see in the anti-hormonal therapies as well. So whether it be hot flashes, joint pain with the aromatase inhibitors, whatever they may be, you can see that integrative medicine, natural compounds can play such a great role when they're used safely. And there's so much we can do to increase the tolerance for all of you ladies moving through all these phases. So integrative oncology plays a major role with that. And then certainly when you're done the definitive care, a major part of what we do is also getting you on this anti-recurrence, really solid, evidence-based, strong protocol and a plan that you can move forward with, putting in place all the things that we know play such a major role in decreasing risk of recurrence. Lifestyle, certainly nutrition and diet, there's some really key pieces there, and then some targeted supplements as well we use. So again, just an applause to the ladies out there that are my patients currently. If you've just received a diagnosis, please hear you can definitely get through these treatments. You really can. And then also incorporating integrative medicine can be a really helpful piece to what you're doing too, so it's something to consider. But with Breast Cancer Awareness Month here, we just wanted to give a heartfelt encouragement to you that you can get through this, that you've got a lot of people in your corner, you need a lot of love at home, but also all of your clinical team around you is there for you. So look for other videos. Again, I'm going to be posting some videos moving through this month. If you have any questions or comments, or if you want to see a specific video related to breast cancer, please let me know in the comments down below. And then I've got my list of things I'm thinking of doing this month for breast cancer, but I'll try to get in your comments and your requests as well. And if I can't get them in this month, certainly we'll circle back and do them in months that follow. So from Oster Oncology to all of you, we just want to encourage you and let you know that you've got a lot of love in your corner and a lot of people there for you. And so from Oster Oncology to all of you, we're here to help you fight stronger and fight smarter. Thank you.